Alrighty, so for sesamoid fracture, initial treatment is going to be some type of immobilization because there obviously is a fracture. So we can use something, either an athlete give them a boot and or give them a pair of crutches. They're gonna kind of be on this depending on the severity of the fracture for anywhere from the first initial injury upwards of 6 weeks. However, we can take these off and do treatment with them intermittently. So in the first initial subacute stage, we're going to have them either some type of protection of them, non-weight bearing, and then we're also going to incorporate some type of ice, any type, and just have them rest, stay off it, not really bear weight. We're going to want to, either we can compress it if there's a lot of inflammation, and then we can kind of elevate it to help kind of drain that inflammation. Some type of treatment interventions we can use e-stim. We can use a gentle pulsing e-stim, and it's over here. So we can use e-stim pads along with the tower. For today's sake, just knock everything out instead of the pads. I'd put the pads across where the sesamoid fracture would be. And we could also use like a gentle tissue massage around the surrounding structures, because obviously if we have something like this injured, the rest surrounding structures are also going to be kind of spastic and tight. So we can kind of just work those muscles, kind of help reduce that spasticity everywhere up the chain from the sesamoid injury. And then we can also kind of do some gentle joint mobs just to keep our ankle integrity there. That way everything doesn't tighten and stiffen up with this prolonged injury. That way we can maintain ankle range of motion leading into toe range of motion. So when we get to our proliferative stage or our proliferation stage, that's going to be roughly from the 2 to 6 week, 1.5 to 2 weeks to 6 week period. And during this time, we can start to get some neuromuscular re-education going. So what we could do is we could use a Russian stim along with the same stim pads, putting them on, scattered across the sesamoids, using the neuromuscular re-education setting on the tower. We could also use a non-thermal ultrasound just kind of around that area to kind of help promote the healing process. And then we can also do some type of soft tissue mobilizations kind of around the different flexors and surrounding muscles and ligaments that are involved with sesamoids, so such as like the flexor hallucis longus, the anterior posterior tib, anything of that nature that kind of plays a role in the sesamoid. And then we can also do kind of like some reflex training to keep ourselves like primed, so that way we're not losing things and we're keeping our reaction times up. So we can just do like the eyes closed, tapping everywhere, having the athlete kind of follow, whatnot. And then for our remodeling stage, which is anywhere from the 6 week mark ahead, where that bone's kind of solidifying and ossifying, we can then incorporate some type of heat. We can do low intensity ultrasound to kind of get deeper and promote bone healing. We can do soft tissue release. So if there's any trigger points along any of these muscles that are associated with it, we can kind of work those out to help alleviate tension there. And then we can also use any instrument assisted. So it's any type of scrapers or any type of cupping, anything that we need to come along here to help really loosen up the muscles associated with ligaments. So.